Hello, my name is Samar Aoun. I am the Parent Institute Research Chair in Palliative Care at the University of Western Australia in Perth, Western Australia, and also in the Parent Institute for Neurological and Translational Science. My chapter, chapter 19, is about public health approaches to bereavement support. And I'm hoping to give a few highlights of the chapter. When Associate Professor Bruce Rumbold and myself, we were looking at this field, the bereavement care support, we noticed that so far most of the information is about people who sought professional services. We didn't know the majority of people who bereave, how do they actually look after themselves, or who looks after them? And really the logical way was to go back to people and ask them, who helps them, in their sort of normal grief that most of us would have to, be part of. The survey showed that really the majority of people, 90% of people, seek help from their family, friends, funeral director, and the community around them that basically they interact with every day. They do seek also support from health services, but not necessarily those who have got bereavement specialization. So probably the pharmacist, the GP, the hospital, school-based support, and very few, about 10%, would really go to professional services, counselor, bereavement support group, social worker, psychiatrist. So in a way, that's sort of given the empirical evidence to what we already know as, people in this field, this is what's happening. We know that the community is really shouldering most of the support that people need after they lose someone. But the interesting thing about is when we asked them how helpful was this support, a lot of them said their family and friends were really helpful, and probably 8% said they weren't helpful. While when we look at the professional group, about 30 to 40% said their experience in professional services wasn't helpful for them. So this really takes us to the really public health approach to palliative care and bereavement care, is that dying and bereavement really sits with the community. It has always sat with the community until things became really pathologized, medicalized, and it's a way to basically turn it around and say, okay, let's go back and see what the community can do first. So if anybody is bereaved, they're really their first port of contact, and the community needs to have that central role in helping them first. And then the healthcare services can be as an add-on, not as the central role that they have in this. We looked at what palliative care services are doing in this field, and it was very ad hoc. Some services do have bereavement support, some services don't. But then again, what people have said is that it looked, the support that they were having from palliative care services was more impersonal, very much of ticking boxes, because that's what the services basically needed to do. So not a lot of people who need bereavement support are getting it, and not a lot of those who need bereavement support are getting it from the right sources. So we really need to go back to the basics and see how we can develop the capacity of the community, the next door neighbors, the people in our social clubs, how they're going to be able to support this. And this is sort of, again, this is the grief literacy that we need to be part of developing the capacity of the community in this. We tried, so basically the pyramid, the three-tiered approach, 60% of the population, in terms of what we say, they have a low risk, and this can be dealt with family and friends. The moderate risk is about 30%, and they need some additional support. How do we, probably from peer support and volunteer-led groups, and about 10% probably high risk and need professional support. But then again, this is just a generalization. There is a lot of people who we may think that they should be at the high risk group, but really they've got a lot of community support, and therefore they've never really needed to go to professional support. So it's not a really sort of a one size fits all. We really need to sort of look at how it's working in at the population level. We tested this with the motor neuron disease people, and again, because it's such a traumatic disease, the moderate risk is much higher than in the general population of bereaved people. So it's sort of, we had 30% with normal grief, 60% with moderate risk. And this is where basically people who are working in this field need to be mindful about getting that support for MND family carers much earlier, and connect them to, again, the community-based organizations that they have in their communities, so help is forthcoming to them. Ireland tried the survey, and interesting that they had the same, again, grief levels, again, the same, sufficiency of support and self-reported mental well-being. It was exactly the same as Australia, which is very, very interesting. You know, bereaved people all over the world, particularly probably the developed world, and we're talking about sort of similar cultures, are similar. So the way it's sort of impacted on practice and policy, it was very refreshing to hear from a lot of service providers, health professionals, how they felt that this model has really helped them into really organizing, their resource allocation, and not really need to think everybody who's bereaved need to come to them. And also those professionals starting to actually make those links with community networks, because this is more sustainable for the bereaved person to be connected back into their communities. So the UK National Bereavement Alliance, have used it in a way to restructure the way they do things. Again, Ireland have based their policy on this. So basically the funeral and memorials, again, that's been conducted. The funeral providers have been key to basically doing that bereavement survey to start off with. And again, because people said they've used them quite a lot as support along with their family and friends, it's opened a new way for them to look how they can, as a community-based organization, how they can support the families that they're conducting the funerals for. Similar way, the Australasian crematoria and cemeteries, they really wanted to be more relevant to their own communities, and therefore reach out in that public health model, how they can help the different cultures that they service in terms of, having cemetery plots and all that to do with it, death and dying. Then we looked, because I've been asked the question quite a bit in terms of, well, how does this differ now with COVID-19? And it was just purely estimated guess in terms of it definitely, the moderate level, risk level would have, increased during COVID-19 for all the reasons that the expected, the unexpected circumstances around the death, the reduction of the physical and social support, the diminished mourning rituals, just to name a few factors. So, so grief basically have been much more felt, obviously, because they couldn't do the normal community rituals that are needed to help families. And again, that we should be mindful of this when we look at what are these resources needed now to support, and I'm saying community resources, not just, financial resources, to be able to support people who have had somebody die of COVID-19. So as a conclusion, as I said, it's really provided empirical evidence to building communities' capacity to provide the type of social and practical support that compassion communities approach advocate for. Again, how do we enhance our local communities and link those bereaved people to people who can help them in their own communities? Again, it's about a bit more sort of training for professionals to make sure that the people they are counseling, they are people who are individuals in communities. They're not people defined by their grief, and therefore all they have to focus on is that emotional inquiry, and then leave people disconnected from their communities. So there is a lot of work that, formal and informal networks need to be working together so that bereavement support foremost belongs to the community, the same way as dying belongs to the community, and get everybody basically knowing that bereavement support has to be done in the community, and everybody else needs to work towards that as a need for our human race. So yeah, thank you very much.